The Tuskegee Syphilis Experiment. Throughout history, African Americans have suffered many injustices as a consequence of their race. One of the worst and longest-lasting examples of this mistreatment is the Tuskegee Syphilis Experiment. From 1932 to 1972, nearly 400 Black American men went untreated for syphilis in southern Alabama. The United States Public Health Service told these men they had been cured, lying in order to learn more about the effect of syphilis on African Americans. Physicians lied to their patients, who inevitably died as a result of the infection, to make medical advancements in the field of venereal disease. Commonly known as bad blood, syphilis could easily be cured by a dosage of penicillin. However, subjects involved in a study were banned from ingesting the cure and were told that because they were government patients, they were getting a different type of treatment. This atrocious study tested the limits of research and proved that scientists overlooked the deaths of hundreds of Black American men in order to make medical discoveries. Not only was this study flawed in execution, but the motivation was flawed as well. The entire study was completely racially motivated. The whole reason that the Public Health Service allowed this experiment was because the subjects were African Americans. Had it been the dominant race that was implicated in this type of human experimentation, it can only be assumed that the doctors would have acted with more professional medical ethics than they did in Tuskegee. An important aspect to keep in mind is that this experiment occurred in a society where racist ideologies perpetuated the inferiority of African Americans, and the process of this study is no different. The deception the patients faced was unethical to say the least, but was spread throughout the county to ensure that men would not seek medical treatment outside this study. In order to achieve continuous observation, the doctors became masters of deception and experts in authoritative manipulation. Compliance occurred mainly because doctors were using their elevated social status to convince the men to continue to visit the hospitals. They also sent a letter to all their subjects stating that they would like for them to come in for a second, very special treatment. Furthermore, by convincing the participants that they were receiving this special treatment, the doctors were able to perform spinal tap procedures to test for the presence of neurosyphilis. It becomes quite clear that the doctors were abusing the authoritative status they held in society with the goal of manipulating innocent citizens. Aside from the fact that they were seen as inferior to whites, Black were also thought of as unintelligent and primitive people. Doctors defended their use of deception by stating that the Negroes would not know to come back for continual medical treatment and therefore needed to be prompted to return to our hospitals. Doctors went as far as preventing men from enlisting in World War II because there were mandatory syphilis treatments given to any men enlisting in the war who tested positive for syphilis. This goes to show that physicians compromised their medical responsibility to treat a sick patient in order to obtain data from infected ones. The reason behind this lack of respect for the subjects was completely dependent on their race. Black men were being taken advantage of by the public health system and by trusted doctors in the county. One must always keep in mind that it wasn't Black doctors treating Black patients. It was, with the exception of a few nurses, white doctors treating Black patients. Despite the fact that almost every doctor involved denied the study was based on race, these men, who were being used as guinea pigs, were in a study group comprised only of Black men. It was quite a stretch, working on that fact alone, to say that this study was not done under racial context. Through extensive research, it becomes clear that if the experiment had been conducted using only women subjects, or a 100% white population, the outcome might not have been so horrifying, mainly because the government would not have allowed such things to occur to those groups of people. In this case, it's obvious that the United States government viewed African Americans as expendable.